Chairman.
The Honourable Annette King.
Mr Chairman, I want to begin by saying that unfortunately we don't have on the table at the moment the report from the very good Health Select Committee. So I look forward to it being tabled in a moment so that everybody could read the report that came from our committee. And to start off by saying that we looked at the Vote Health, the amount of money that had been put in this budget 2016, and to see whether there was sufficient being put into the budget to keep up with health demographics and inflation. Unfortunately, the budget does not meet all the demands in health, in demographic pressures, in aged care and cost pressures. What they really needed in this budget was an additional $635 million to just keep up. And I'm going to go on to more about that in a moment because I think the Minister himself has recognised that the health sector is under tremendous pressure. And what this budget did not do was to address that pressure by putting in sufficient to cover what are the basic costs: population growth, the cost pressures, demographic ageing. And so the Minister, although he said there's more money in health than there has ever been before, is a hollow cry if it does not meet the needs in the health budget. And so the Minister, I might remind him, himself said very recently that the country's 20 DHBs are under more financial pressure than ever, largely because of the population boom. He also, I'm reading directly, Minister, from your very interesting interview with the Listener where you were quoted. You also said, and here's a quote from the Minister, they're going to have to absorb, quote Minister, they're going to have to absorb a record amount of pressure, no question about it. And so the Minister himself has acknowledged in a frank interview in the Listener, perhaps he wasn't aware of what was being recorded, he has admitted that they're going to have to absorb a record amount of pressure. Now that pressure comes from cost pressures, it comes from population growth, and it comes from ageing. And so, Mr Speaker, Mr Chairman, that is the first point I wanted to make. I then want to go on to one particular part of the health budget, which I did raise when the Minister came to the Select Committee, and that is the amount of money that is being put into primary health care. Primary health care received $186 million, up from $180 million. $6 million additional expenditure. The Minister said they had plenty of money. That was his response when questioned about it. It wasn't a very, very good Select Committee hearing, I have to say. The Minister came in a very bullish mood and argued with most members of the opposition. But the Minister was asked about the $186 million going into primary health care. He said they had plenty of money. Well, I find it very interesting now that the budget is out there and the primary health care sector is looking at the budget whether they are saying they have plenty of money. Well, of course, the Minister went off to meet with the doctors at their conference recently, and it's interesting to see what the Doctor magazine said about that in the budget for 2016. They headed an article called "To the Bedside Manner Born." To the bedside manner born. It said his bedside manner was the pits. It said his delivery of bad news on funding was far from textbook. He said he was decidedly more like Martin Clune, aka Doc Martin, in his approach. It said that he had failed to acknowledge there are 600,000 people classified as high needs, and I raised this with the Minister, classified as high. This was written by a very good person, Mr Simpson, Barbara Fountain, who does write for the Doctor magazine, usually very, very supportively of the National Party, but this was her editorial following the budget. said that he had failed to acknowledge the estimated 600,000 people classified as high need who are unable to get general practice care at a reasonable price because they were not part of a very low-cost access funded practice. They said in this article, their blissful ignorance is less a political liability than what would arise from the murk if better-off voters lost the subsidy their patient fees. And they said the minister was more concerned about that than he was about the 600,000 people who do not receive a subsidy. Dr Coleman's announcement, it went on to say, Mr Chairman,
The Honourable Annette King.
They went on to say his announcement at their conference left the primary care listeners stunned and largely speechless. And that is why, the reason why is the minister decided not to address an inequity, which I raised with him at the Select Committee, an inequity for 600,000 low-income New Zealanders who do not get the subsidy. Now, I'm not saying it was going to be easy, but they had a report that made recommendations to the minister to address this issue in the budget. And unfortunately, the minister did not address it. So today we have the latest comments from the primary health sector, and it comes from the largest PHO in New Zealand, from ProCare. And they're demanding to sit down with the minister over funding fears coming from this 2006 budget. The chair said they fear, listen to this, Mr Chair and the minister, the chair of the largest PHO fears for the viability of general practice if problems with the very low-cost access subsidy and capitation were not resolved. ProCare board is extremely disappointed with the Health Minister, Jonathan Coleman. And Dr Harley said this, combined with the flawed process of determining annual fee increases and the government's proposed uplift in capitation payments for the coming year of just 1%, we believe there is a genuine threat to the viability of comprehensive, equitable and high-quality general practice. He said that the working group, in their report that the minister got that he could have addressed in this budget, the working group report noted that capitation had not kept pace with inflation over the past decade. 8 years of it have been the National Party in government, and if the minister wants to raise it, it's 11 years since I was the minister. And also they said that they then have refuted.
11 long years.
Bill English was Minister of Health, I have to mention that, was Minister of Health, that left the health sector in disarray, and we had to then spend the 9 years in government straightening out his mess. So the primary healthcare sector have asked to have a meeting with the minister to put these issues to him. And I say to them, don't hold your breath. Don't hold your breath, because I happen to know many health groups who have asked to meet with the minister who are still waiting for the phone call. They're on the never. The minister's not so keen to meet with people who might disagree with them. And the primary sector, his own profession, general practice, the GPs who do the first line, the front line role in health care, that is what they are saying, Mr English. Maybe Mr English would like to read it, because if he doesn't want to believe me, then these are those who are practitioners. He might even hear it at home, because primary health is being starved of funds, and they are now saying this is the worry. Meanwhile, ProCare has been encouraging its own very low-cost access practices to go for cap-busting fee increases. What does that mean, Mr Chair? It means cap-busting fee increases are paid by the patient. They are paid by patients who are very low-cost access, people who do not get a subsidy. That is what they are saying, because they have insufficient funding. Now, I think that we have got a problem in the health budget under this government. $1.7 billion is missing from the health budget, $1.7 billion, and by stealth, this government has been running down the health system of New Zealand, and then we hear of some of their mad not even off the shelf, they're out of this world ideas. Bill English's mad ideas of social bonds that play fantastic, and it fell over, Minister. It fell over, and you said, "Oh no, it's going to work." It fell over in mental health because why not pay the providers of mental health services, the very good NGOs, pay them direct and cut out the middleman? The middleman was the ANZ Bank. They wanted the ANZ Bank to fund mental health services, and if the NGOs delivered the outputs and the outcomes, then the bank got a dividend. Have you ever heard of anything so damn stupid in your life? I have to say, Mr. Speaker, this is a terrible government when it comes to health.
The Honourable Jonathan Coleman.